now as a medical director. So over the last few weeks, you've heard from a few of my colleagues about KenSci and who we are and what we do. And I'm going to spend today's session talking about the role of healthcare professionals, specifically doctors at KenSci, and to try to explain why, how this makes us unique and, why we think that having doctors on staff is so critical to the success and to our mission. So when I tell people that I'm a physician at a tech company, I often get puzzled looks and lots of questions. And if you think about it, it is a bit of an unexpected and definitely uncommon role for physicians to have. But it certainly makes sense that doctors and nurses should be involved in the work of an ML company focused on healthcare. And we have a number of physicians at KenSci, and they are in a variety of roles. We have subject matter experts who are physicians who are able to go really deep in one particular area or field, like cardiologists, for example, to really help us with, cardiology-facing issues. We also have medical directors, which is my role, which is really an opportunity to work across the organization, to work with our business leaders, to work with our sales folks, our data scientists and engineers, really across the spectrum of the customers and hospitals that we work with. Our chief medical officer is a physician, and he's really a member of our executive. And then we also have physicians functioning as product managers, where they really work with the engineering side to dive deeply into the solutions that we are creating and delivering. So what I'd like to do now is kind of go through several different sort of facets of what I think physicians can bring to the table to sort of support KenSci's mission and that makes KenSci a leader in this field. We work with brilliant data scientists and engineers and business leaders at KenSci. So I'm realistically very humble when when we talk about what clinicians do. But hopefully this will give you a little bit of light into our role. So this first one is really the most critical, and that's that we are patient focused. And quite simply, the patients are the reasons that we're here. They're the reasons that the physicians are here, and they're the reasons that really why KenSci is here. The patient is at the center of our work, and as healthcare professionals, we emphasize that in everything that we do. As physicians, we take the Hippocratic Oath when we enter the medical profession. And this oath really speaks to sort of the solemnity of the field and of really the role and the responsibility of the physician in always trying to, do their best to take the care of the patient. And what we've done here at KenSci is we've actually kind of extended this Hippocratic Oath and invited our data scientists and our engineers and really everyone across the organization to sort of take part in it, to realize that we're all in healthcare. And that behind every data point is a human life, and that it really is a privilege, and along with that privilege, a responsibility of being in this field and in these roles. So I think as physicians, we also bring a different perspective to the tech environment. We are, used to working in a fast-paced and high-stakes industry, but healthcare is different than tech, and changes can be slow. They can be, very strategic, and there's a lot of layers to sort of healthcare and how changes occur. We also have a lot of experience working with multidisciplinary teams, which is very key in our role here. And mentoring and teaching are really key components of how healthcare is practiced and how it is furthered. And also sort of being a continuous lifelong learner is certainly something that is critical for physicians. So getting kind of a bit more to the nuts and bolts of what we do, one of those priorities is really the ability to translate complex ideas. Everyone is aware that healthcare is incredibly complex, and it really, every level you look at it, from the infrastructure to the data to the semantics of that data. But really being able to understand what that means, and that foundational knowledge of the field of medicine is necessary to be successful. And there's so much that when, as a physician, when you take a glimpse at a patient or you see their chart or you're even looking at some of their, their data, you sort of formulate a picture in your mind about what that patient is going through and sort of what they're experiencing and, what they look like. And it's interesting talking to data scientists and engineers about how we see that in the data and how can we sort of, what does the data mean from an actual clinical standpoint. But it's also important to kind of realize that that's a balance, right? I don't need to be lecturing the data scientists on the nuances of intensive care unit care, right? They don't need to know all of that. So it's sort of realizing that we can up-level the understanding of healthcare across our organization to a level that is really helpful for, conversing with hospitals and health systems and people in various roles, and also for the actual work we're doing with machine learning. So all of the physicians who are at KenSci do have backgrounds in actual clinical practice. So we've all actually been sort of on the front lines of care delivery in different roles and in different areas of specialty. And I think this is really something that shouldn't be overlooked, that we do know that healthcare is complex, the delivery of healthcare is complex, and that it is really invaluable to have that experience about delivering care firsthand. I think when a lot of people conceptualize the physician-doctor visit, that's really all that you see. Most people don't have the opportunity to sort of stroll through hospitals and look around and see how decisions are being made and see how processes are being enacted, which is something that we have seen. And I would also say, conversely, that it's also really interesting and important to be open-minded and to listen to new and alternate approaches related to sort of healthcare delivery. It's so fascinating to me when I can talk to, someone at KenSci who does not have a healthcare background, but they sort of ask a really interesting question about why something is done a certain way or why a certain decision is made, and it leads you down sort of new conversations that that can really, lead to new ways of approaching old problems. As physicians, we also have experience in the clinical application of insights, which can guide some of our product development. And as we talk to customers as in hospitals and health systems about, what they're interested in solving and taking that back to what we're making at KenSci. And there are a number of analytic tools that are available for physicians as well as other end users in healthcare. And it's really important to be one of those solutions that is useful, that is used, and that makes the life easier for the end user. So it's really important to have a deep understanding of those end users and their needs. And in healthcare, it's so much more than just physicians. There's care managers, there's of course nurses, there's administrators, there's bed managers. There's really dozens of potential roles of people who are involved in the care of one single patient. They can be, can have their operational workflow, augmented with artificial intelligence and machine learning, and really knowing what tools they have currently, sort of what they're currently doing and where their pain points are, is really important as we're thinking about how our solutions are enabled. So I think also as physicians, we are in a good position to talk with hospitals and health systems about what they're going through. And, it is the clinical experience that we have, but it's also being sort of part of this physician group of shared experiences. As in, many other professions, of course, have this, but it's nice to be able to talk to someone with a similar, educational and training background on the other end of the phone or at the other side of the table. And similarly, we also have a very shared vernacular, that is very different than many other professions and fields. And so, a lot of sort of communication issues can sort of be shortcutted by having a couple of doctors on the phone, sort of talking, about what they see as potential issues or solutions that they want to experiment with. And finally, I would say that, being in this role, it's really exciting because we get to collaborate closely with our peers at other institutions, at hospitals and health systems. And some of them, are folks that are on, that might have very shared backgrounds with us, and actually sharing their successes. It's really exciting to get to support our customers when they talk about the great work and innovative work that they've done and that we've been a part of. Hospitals and medical systems have had conferences for their specialists and for their doctors to participate in. I mean, it's really exciting to get to see them be on stage sharing the fruits of their labor and of their innovation. So I think that covers most of what I wanted to sort of highlight today in terms of what our role is here at KenSci and sort of how we think that our role enables part of KenSci's mission. And that's it. Any questions?
Excellent. Thank you, Dr. Hurley. I enjoyed your presentation and appreciate that you left time for questions. I see there are several people on the call. Are there any questions that have come up for the attendees who are participating? Anything that someone would like to come off of mute and ask Dr. Hurley a question about KenSci, her work, what she's just described in this presentation, or if there's a question that you want to drop into the chat and we could take questions that way as well. Okay, I won't pressure people for questions, especially on a Friday afternoon. Definitely appreciate your time and taking the efforts to put this presentation together. Dr. Carly, I guess from my Microsoft perspective, I'll ask one question before we depart off of the call. I guess what I'm wondering, having listened to the previous 3 presentations from your colleagues at KenSci and also your presentation, what do you think makes the makeup of the staff members, the passion, the energy you all bring to your work distinctive about KenSci as a company, especially when you consider the type and scale of impact that the company is trying to drive in healthcare?
Yeah, that's a really good question. And I think a lot of it is kind of the ways that we collaborate across groups and across teams. We have a really just, great relationship between within our teams, first of all, but also, between teams. I love it that I can sit down next to a data scientist for the day and work through a specific project or program. And an engineer can come sit next to me and ask about, certain clinical problems. So we have a very open atmosphere for sort of shared learnings and cross collaboration across, disciplines. And I think that gets people excited. We have a lot of people at KenSci that just love to learn. And I think that's a fantastic environment for what we're doing because we can all learn so much from each other. And, these healthcare problems are big and they're not going to be solved by one discipline. So I think we're excited by that opportunity and we see the fruits of our collaborative labors and it's really rewarding and encouraging.
Yeah, absolutely. I guess my follow-up and last question to that is, wishful thinking and hopeful thinking as a physician, as someone who's doing your body of work every day, what would you say is the kind of aspirational goal that you as an individual have around the work that KenSci is doing, but just the potential global impact that you like to see in the next 5 years or, even before you retire? What would be the distinctive mark you'd want to see with this type of work?
Yeah, that's a really exciting question. I think we all come from different sort of disciplines of medicine, so different sort of areas that we were initially interested in after medical school. Of course, we want this to continue to spread widely and fully across the range of healthcare applications from, the inpatient space to the outpatient space, and really to just improve patient care. I think there's a lot of potential, and it's exciting to see sort of the adoption of these tools progress. And I think that just kind of watching that actually and the growing impact this is going to have on patient lives over the next 10 years, I think it's going to be very rewarding.
Awesome. Well, thank you, Dr. Hurley. We appreciate your time, and we definitely appreciate this partnership with KenSci. It's been a very exciting series. As I mentioned to everyone at the beginning of the call, all of the recordings will be available on demand in Microsoft Partner Community. Thank you all for joining today, and have a great day.
Thank you.
All right, goodbye.